Okay, welcome to this presentation. This presentation is a guide on how to assist for root canals. Um, we'll go through what a root canal is, what's required for the setup, and hopefully an explanation of what we're doing at every single step so that you as a dental assistant become familiar and clued in as to what we're doing, why we're doing it, and that allows you to now make an educated guess as to what the next step is, so you can set up quicker, more efficiently, and allow the appointment to run smoother. So this is a presentation I put together a while ago. There will be some errors. We're just trialing out recording it and putting it onto YouTube, and we'll see how that goes. Okay, so root canals, this is a guide for assisting with myself. Bear in mind every dentist will be a bit different, but I dare say everything is fairly common. Another dentist isn't going to do root canal completely differently to somebody else. Use the same materials, same techniques. It's still the same goals and the same outcomes. So what is a root canal? So a root canal is the colloquial term for root canal therapy, or RCT for short. So if you hear any of these terms, we're talking about endodontics, which is the field of treating inside the tooth or the nerves. This is providing therapy on the canals present in the roots of a tooth. This is needed because there's something wrong with the nerve. Either it's exposed, or there's decay in it, or bacteria in it, it's inflamed. Or pulp is the name for the mixture of nerves and blood vessels. Majority of the time the issue is bacteria has entered the canals, or it's an autoimmune condition. That's something we'll go into later on. So this is the basic anatomy of a tooth. That's the pulp chamber. So we should all be familiar with the enamel and the dentine. And you can see in this example the decay has reached into the pulp. And in the second image you can see the infection. So they're the roots. That's the root canal. Some patients believe when you do root canal you take the roots out. No, the roots stay there. It's just we take the nerve that's inside the canals in the roots out. What is the aim of root canal? The aim of root canal is to remove the diseased pulp, to remove the diseased internal surface of the tooth, and seal off the tooth to keep it sterile. So the first step is stage 1, second, stage 2, stage 3. Again, these are terms that some dentists may refer to the various steps of root canal as stage 1, stage 2, stage 3. So stage 1 is you just go in there, take the nerve out. Stage 2, you scrub the inside of the tooth and rinse it. And step 3 or stage 3 is you seal the tooth so no more bacteria can get in. So the aim of root canal, as I said here, this is needed to help keep the tooth disease free so the patient can retain the tooth. So the aim of root canal is for the patient to keep their tooth. The other option will be an extraction, obviously. So who needs root canal? Anybody with an infected tooth, okay? Anyone with a tooth too broken just to do a filling, okay? And that's post and cause. I mentioned more on this in our crown presentation. Is root canal tricky? Each tooth has a number of different canals which the dentist has to find. So that could be a tricky bit for the dentist. That can take some time. It also sometimes takes time to go down the canal because you want to go all the way from... Can I go backwards? No, I can't go backwards. It can take time to go all the way down from the top of the tooth down the canal to the apex or the tip of the root. So these are the stages, okay? Extirpation, so that's stage 1, okay? So again, there's a lot of terms. So stage 1, step 1, extirpation, they're all the terms I can think of. So extirpation, definition is to remove or destroy something completely, especially something that's living. That's a formal definition. So extirpation is we're taking out and we're destroying the pulp. We're trying to get rid of whatever's left so that we can clean the inside of the tooth. Okay, so the purpose of extirpation is to get the patient out of pain, to remove any remaining nerve, to irrigate or to wash the inside of the tooth, and to place medicaments or dressings into the canals. So these are pastes usually. Stage 2, step 2, CMP or chemomechanical preparation. Okay, the name says it. It's chemical and mechanical. So chemical comes from the hypochlorite that we use to rinse inside the tooth, and mechanical is the scrubbing action. So think about it as like washing a plate. You use soap, which is a chemical, and then the mechanical is you moving your sponge to scrub. So that's chemomechanical preparation, or step 2, stage 2, or CMP for short. Again, every dentist refers to it differently. So stage 2 involves using irrigation and files to clean the canals to remove all remaining nerve and bacteria. Okay, so step 1, we've got in there, we've rinsed it out, taken away some of the nerve, we killed it. Step 2 is we want to make sure we do a thorough clean. We want to get rid of all the bacteria. So chemo or chemicals, there's 2 main ones that we use, NaOCl or sodium hypochlorite, or another term is Milton's. That's the brand name for bleach, or they might just call it bleach. I prefer you do not call it bleach in front of the patient, because patients might freak out if you say, give me the bleach to wash this patient's tooth. When do you need sodium hypochlorite? You need it at every single stage. Step 1, step 2, step 3, stage 1, 2, 3. The purpose of sodium hypo, hypo is another term for it. The purpose of hypo is it dissolves any pulp tissue, it dissolves any blood, and it also disinfects. And we use it as an irrigant or something to wash the inside of the tooth, because when we do our chemomechanical prep, there's lots of debris because we're shaving the inside of the tooth. Lots of those shavings fall inside the canal, and we need to wash them out because it's all infected. Think about it like rust. We're scrubbing the rust away, and then the rust piles in, and we rinse it until we get a nice healthy tooth. EDTA, bit of a mouthful, ethylene diamine tetraacetic acid. I use this only in the final stage. Okay, some dentists may use this every stage. I use it only in the last stage. Okay, again, this is how I do root canal. A lot of dentists do it this way, but obviously when you come to work with the dentist that you're working with, you have to learn their preferences. EDTA doesn't really do much from my understanding on disinfecting. It just helps dissolve some of that debris away so that the canal is more empty, and our files, which we'll get into, can go down all the way to clean all the way down to the tip of the root. So that's chemo, and then mechanical. So this is where we use our K files, rotary files, Hedstrom files, endoactivator. So pretty much any machine bit to scrub the inside. So we'll go through that. Okay, stage 3 is obturation. The definition of obturation is a device or a structure that closes an opening in the body. So when we obturate, we are plugging the tooth. So we're closing the opening, we're closing the canal, so no more bacteria can get in there. So this is the final stage, stage 3, obturation. This is where the canals are plugged, so no bacteria can enter the tooth's canal again. This stops bacteria from the mouth going down into the tooth. This also stops bacteria from the infection coming back up into the canal. Once this is all done, the final filling is done to seal the tooth off. Sometimes the tooth may require a crown. Okay, so this may not be the final step for the appointment today. A lot of the times it is. Again, depends on the dentist. I like to do obturation and crown prep on the same day if I have the time, just to save the patient another visit. Okay, next slide. Okay, so what do we need? The good thing about root canal is you need the same things over and over again. Okay, the only time it differs is when you're doing specific things for that appointment. Okay, so when we get to it, I'll talk about it, but you don't need the rubber plugs for stage 3 in the first stage. Okay, so these are the essentials. These are what you need every single appointment. So you need the rubber dam setup, you need your restorative or your filling setup, you need irrigation, you need to take x-rays or periapical radiographs or PAs, you need a ruler, you need paper points and you need K files or the files needed for the appointment. Okay, so what do we need? We need the essentials. So rubber dam setup is your rubber dam, your flossed clamp, your clamp forceps, widgets, hole puncher, floss, Orasil putty or paste, and frame. So the first one is the rubber dam. You might have seen this. It's a rubber sheet, quite stretchy. This isolates the tooth so that no saliva in the mouth or bacteria can enter the tooth again. So you can see in the picture there, the patient's tongue can't push saliva into there because it's formed a boundary. Okay. This also protects the patient from irrigants and debris and also the tools that we use. So when we get to K files or rotary files, I'll show you, they're quite sharp, and there's have been incidences where, obviously not with me, incidences where patients swallow these files, they get stuck in the lung, and it's a nice lawsuit for you to deal with. Flossed clamp. So we need to put floss around the bow of the clamp, and we'll go through what clamps are in a minute. This is in case the patient, or it flicks off the tooth and it goes down the patient's throat. You've got a nice big bit of floss to grab it so that they don't put it into their lungs. Okay. This also holds the rubber sheet down around the base of the tooth, so it's used to secure the rubber dam around the tooth. And as I said, the floss is to retrieve the clamp if it falls. Clamp forceps. Please be careful with these ones. These are not the same ones we use for the Palodent or the V3 rings. These have two little pegs here which engage in the two holes that are present on a clamp, with the exception of an anterior butterfly clamp, but it's used in the same way. These are required. Okay, it helps stretch and open the clamp so that it fits over the tooth. Widgets. Okay, so these are like floss. When you stretch it, it becomes really thin. So we use this to secure the dam between teeth, sort of away from the one that we're clamped. Okay, so again, this just holds the dam down. Hole puncher. We need to punch holes in the rubber sheet so we can stretch it over the tooth to let the tooth sort of poke through. This is what a hole puncher looks like. Okay, so we have our little ring here that rotates, and we have a puncher, and then this is squeezed. Okay, this is what the ring looks like from the top. Okay, so it goes from size 1 to size 6. It may not be labeled on your hole puncher. There may be 7 holes, maybe 5. It doesn't really matter. All you need to know is big hole for a big thing and a small hole for a smaller thing. Very logical. Okay, so size 6 is used to fit over the clamp. Size 6 is used. Okay, so you can see here this whole complex, tooth and clamp, you want to be able to stretch the rubber sheet around all of that. So you're going to use your biggest hole. For something like a small lower anterior tooth, you're going to use size 1. You don't want the hole to be too big, because then when you put it around the tooth, there may be a gap, and then when you use the hypo or sodium hypochlorite, it may leak. You also don't want to do it too small for a big tooth, because when you stretch it, it will rip. And then again, that doesn't isolate the area because there's a tear in your rubber sheet. Okay, so as a rule of thumb, do size 6 for the big ones, and then sort of move your way down for it. Simply put, the bigger the hole, or the bigger the tooth, the bigger the hole. So pretty straightforward. Floss. Okay, so have some floss handy. This is to help push the rubber dam down between the teeth so that it sits low near the gum, because if it sits high up, it's just going to flick off, and then your hypochlorite is going to go down through the rubber sheet through the hole into the patient's mouth. So isolation is what we really want to do. So I use this. It's called Orasil putty. This has been a game changer for me. I put this around the edges of where the clamp and the rubber dam meet. Okay, and this just helps seal off any tiny sort of gaps that may be there. Again, limiting the potential for hypochlorite to go underneath the dam and start to irritate the patient's throat. I'm not sure if you ever tasted bleach before, but it's not nice, and it can really irritate the patient depending on the concentration of the hypochlorite that you use. Okay, there are some specific tips that go with this because this is quite thick, so do not put flowable tips on there. The metal tips. You need these special tips here, otherwise the dentist can't squeeze it through. Okay, so look at it before you give it to the dentist. Some DAs say, oh, somebody must have put the wrong tip in there on it before they put it into the drawer. Doesn't matter. You're handing it to the dentist. Make sure you put the right tip on there. And I always encourage all my dental assistants just to squeeze a little bit onto a bib or a paper sheet, just to make sure there's no blockage, and make sure it flows, because you don't want to hand the dentist something that's blocked. Otherwise, what's the point? Make sure it works. Make sure the right tip's on there. You also need the frame. Okay, so these little spikes here, you stretch the rubber dam over it and then it pins it, and that helps hold the dam stretched over the mouth. That's required as well, so when you suction, you don't suck in any loose dam and it gets sucked into the dam and makes a very high-pitched noise. Restorative setup. So this is everything you need for a filling. Okay, so you need your drills, your high speed, your slow speed. I myself have a root canal and a crown burr pack, which is in my second drawer. These are specific burrs that I use for root canals. Again, that's dentist preference, but these are mostly longer burrs so that we can go down deep. Okay, so normally when you do a filling, you probably only drill sort of there to there, so you only need a short drill. But when you're doing root canal, you're drilling all the way down there. So I've got long drills, and I've got this special drill bit here. It's called the Endo Z burr. It's a gold shanked burr. I think I talk about it in the next slide. But that's in my pack. But yeah, I encourage dentists to make their own packs. Okay, I also require a ultrasonic scaler. Okay, this is the same scaler we use for our checkup and our cleans. I use this because it shakes out the debris that's in the tooth. It also helps me get rid of any weak structure in the tooth as well, so I can open up the canal. Your resto kit is your flat plastic, ball burnisher, mirror, tweezers, and probe. Also your miller's forceps to check the bite. And then we need some sort of filling. Okay. Again, dentist preference, but it could either be composite or Fuji. Okay, so if you need composite, you get your etch and your bond. Okay, if you're going to do Fuji, get your dentin conditioner. Irrigation. So again, these are the essentials. These are what you need every single appointment. Okay, sodium hypochlorite, I use a lot of this. I believe that the success of a root canal depends on how well you irrigate and clean it. If you don't irrigate it enough, you'll get probably a failure on your root canal. I require 2 10 ml syringes of hypochlorite at all stages. So you get your Lure-Lock syringe and you get your 10 ml syringe. Okay, this is only a 3. Anyways, get a 10 ml syringe. And then I like to get the DAs to put a little bend in that and then put the cap back over it, just to help me sort of get it into the tooth and irrigate. EDTA, I only use on the final stage, and I don't use much of it. I just need a 1 5 ml syringe. Okay. Again, these are the essentials. You need an X-ray, and you need an X-ray at every single stage. Okay, so stage 1, you need to see it. You need to use it to see the state of the tooth, to see if there's decay. The dentist will use it for diagnosis. So you can see this is stage 1. So we use the X-ray to diagnose and say there's an abscess there or a periapical lesion going up. Most probably due to this deep filling in this pin, perhaps. Stage 2, the dentist may use this to check to see if the file's down all the way. So you can see here the file's down all the way on the distal canal, but on the mesial it looks a bit short. So the dentist may use a PA to check the file's progression through the canals. And then stage 3, I mean, correct me if I'm wrong, I think it's a legal thing. You do need to take a final X-ray to make sure that the obturation or our rubber filling has been done to an excellent standard. Some dentists may use a PA during the stage, the third stage, just to check to see if their rubber cones go down all the way before they put sealer and stuff on it in the end. And we'll touch on sealer later. The dentist needs a ruler. Okay, we need to check the lengths of things. Okay, so between appointments, we need to make sure we can repeat what we did in the last appointment. So I need to know exactly how long it is. The canal is from the top of the tooth to the tip. So we use a ruler with very fine 0.5 millimeter measurements to do that. So there's two ways to measure. There's just your stainless steel rulers, or you can get an endo block. I do like these because when we come to do stage 2, you can just put your file in there at the correct length. That will give you 14, 14 and a half, 15. And it also has got rulers there. These notches here are where you put your rubber stopper. And again, we'll talk about that in a minute. Paper points. Okay, after every appointment, we need to dry the tooth. Okay. Why? Because bacteria loves moisture. So if you remember, the goal of root canal is to eliminate the bacteria in the tooth. Okay, we don't want to make it an environment for bacteria to replicate. So if you dry the tooth really well, any residual bacteria should die off. Okay, they come in different sizes. Fine and medium I use in the first stage because we haven't cleaned the inside of the tooth to a certain shape. But once we get to stage 2 and 3, which is here, your tailored sizes, then they make specific, special shaped paper points, cones, that fit in nice and snug and touch all the walls of the canal, and it wicks away all that moisture very quickly. And then the last step you need are K-files. Okay, you may argue you don't need this in the final step. I always have at least a 15 K-file in the final step, just to make sure that once I've opened the tooth again, no debris falling into the canal. So I go down all the way, make sure I can still go all the way down to the tip of the tooth, and if I can, happy days, then I can confidently put my rubber points for stage 3 down the canals. Okay, so you need at least a 10 and a 15 for all stages, but for me, just the 15 in the final stage. Okay, so K-files, why do we need them? We use them to explore the canal system and to shape the tooth. Okay, so you can see here, this is the tooth that has not been shaped. You can see here it's really wide there, bit of a small narrowing there, wide again, narrowing, and you can see very narrow there. Okay, so what we do is we introduce a size 10. So this should fit all the way down to the tip in most cases. And then what we do with our K-files is we gently introduce a thicker one and a thicker one and a thicker one. And as we get thicker and thicker, it starts to give a nice round profile, as you can see there. So you can see it's quite even all the way through. It's quite round as well. And this is what allows us to get our rubber points down all the way. Because if you put a thick rubber point or GP point down here, it's going to go there, then get stuck there, and you can't go down there. So this gives a nice taper, or a nice sort of gentle sort of gradient from thick to thin. So really tight canals may need something finer than a 10 or a 15. Okay, so what these numbers represent is the width of the tip of the file. Okay, so the smaller the number, the thinner that little tip is. The downside is the thinner the tip, the easier they bend. So if the dentist requires a size 6 or size 8, have a few on standby, because very easily if you put it in there, it will just get stuck there, and then it'll ping on that, and then it'll just bend. So we've touched on this. Canals are not naturally smooth, so the files are used to flare out the canals. Yeah, that's a good word. So that we can obturate with a preset shape or taper, which is our different sizes, F1, F2, F3. You need to be able to put a size 15. Again, this varies dentist to dentist, but you need to be able to put a 15 before you start using your rotary files, which we'll get onto later. Yeah, cool. So help clear debris. Sometimes tooth debris or other stuff can drop down. The smaller K-file will help clear it and make sure we can do and make sure we can do. Anyways, so we use this, as I said, sometimes when you open to get any debris out. Okay, time to work together. Okay, so I've gone through and I put these little keys to success throughout the presentation. These are the things that I think if you remember to do, not only will it make the appointment nicer, but the patient will have a better experience. Okay, so these are ways for you to excel as an assistant. These are ways for you to show that you're competent and sort of shine above the rest. Okay, so things to set up for before the patient arrives. Okay, so everything should be out to the corresponding stage. Okay, so if you're doing extirpation, we need the essentials. In terms of K files, ISO 10 and 15. If the dentist is doing a molar, perhaps have 6 and 8 standby ready, just in case we find the canals are too tight to get a 10 in. Okay. We also need medicament for the tooth. Okay, now there's two types of medicaments. All right, there's UltraCal, which is ultra calcium, so calcium hydroxide. That's a medicament that just helps keep germs dead. Okay, so this is used when the patient is experiencing no pain at the start of the appointment, or the dentist is sure that they removed all the nerve or all the pulp. Okay, so the other option is this odontopaste. This has a antibiotic in it and also a steroid. So if I removed all the nerve, the steroid's not going to do anything because there's no nerve to calm down. Okay, so the dentist will let you know, but again, as I said, if you do understand what we're doing and why we're doing it, you can be very clever about it and just bring up the UltraCal. One less thing for you to wipe at the end of the appointment, and the appointment just runs quicker and smoother. Okay, so UltraCal, there could be different brand names for it, but calcium hydroxide non-setting paste, make sure it's non-setting. It will be written on the syringe. Okay, the other thing that we can use is odontopaste. Not sure if they make it anymore, but there used to be something called Leader-Mix, which has a steroid and antibiotic, but we don't really use that, especially in Australia. I think odontopaste is an Australian brand. So we use this is when the patient is in pain or the dentist isn't sure that they've gone down every canal in the tooth. Okay, so this just helps get the patient out of pain quick so that you can see him again for stage 2. Okay, stage 2, chemomechanical prep or CMP. We need the essentials. We need our 10 and 15. We may not need 6 and 8 if the dentist was able to go down all the way with the 15s. And then we need our rotary files. So at the Goldman Center, we use ProTaper Ultimate. So we have F1, F2, F3. If you use ProTaper Next, I believe it's X1, X2, X3. Familiarize yourself with the rotary file system that the clinic uses. You need an apex locator. So this is a special machine used for stage 2. You can also use it in stage 3. Again, depending how the dentist prefers to do their root canals, they may use it to verify how far down they can reach in the tooth. And then at stage 2, you also need the medicament for the tooth. At this stage, if the dentist has done stage 2 completely, there is no nerve in the tooth. Okay, so the dentist will use UltraCal or calcium hydroxide, non-setting calcium hydroxide. Again, if there's no pain or the dentist is sure they removed all the nerve. The reason why we don't use odontopaste in stage 2 is because if we put a steroid or an antibiotic in the tooth at this stage, because the next stage, remember, is the final stage. If we put calcium hydroxide, if we put a steroid and antibiotics, it's going to silence any pain that might still be there. So we put the medicine in there, patient's going to come back in a week or 2 saying, yep, it's fantastic. And then very stupidly, we will obturate the tooth and there's still lots of bacteria, still lots of infection. And then a couple of weeks later, the patient will come back in pain. Not a happy patient. And then stage 3 is our obturation. So again, you need the essentials. I like to have a 15 just in case. just to check to make sure there's no debris blocking the canals. And then you also need a sealer. Okay, so Tubisil is one that we use. At the moment, I'm using one called Endosequence by Ceramic Sealer, which is what a lot of specialists like to use, and I like to use it as well. And then you need your GP points. GP stands for gutta percha, and that's what these things are here. Okay, and you can see they're labeled F1, 2, 3, 4, and 5. ProTapper Ultimate after F3 has FX and FXL. Again, familiarize yourself with your kit. You also need burn tools. Okay, so each clinic, depending on how they do it, they will have a couple of ball burnishes or pluggers that may be black on the tips. That's because they've been heated up by the Bunsen. And what we do is we heat it up and then we melt the GP point there, and then that just leaves this bit here in the tooth and makes it flush, and we'll show you what that looks like later on. And then you need, for your final filling, your etch bond, your composite, depending on the dentist's preference. Okay, so again, this root canal can be done quickly. I know a lot of DAs dread setting up for root canal. I don't see why. It can be set quickly if you remember what step you're doing and what we're doing. Okay, so patient comes in, we're going to numb the tooth. Okay, so you're going to put topical. I like to have one lignocaine and one articaine ready. I use a short needle for the uppers and a long and a short for any lower tooth. So if I'm doing a full 6, please bring out a long and a short. If I'm doing any upper tooth, give me just a short 21mm needle. If you're not sure, get both out, okay? Just to be quick. I don't want you to just assume I need a short and then I end up needing a long. Just bring both out. Shows you're more prepared. And then give the patient, instead of just water, give him flavored mouthwash, okay? So we use this, berry drops or mint drops. Make sure that's ready because the patient's going to need to rinse, okay? And again, this just allows the patient to have a better customer experience. Okay, it takes a second to do, very easy. Patients like it. Okay, how to set up rubber dam. I think there's a video there. I'll see if I can click it. Make sure the dam, punch and frame and clamper are ready. Okay, so pay attention when the dentist is talking to the patient as to which tooth is being treated. If the patient says, oh, the tooth right at the back of my lower right jaw is hurting, okay, we're doing a molar. Okay, you need a molar rubber dam clamp. You need to punch a big hole. And then there should be a little template to show you where to punch a hole in the dam. It comes with every box of rubber dams. Somebody might have thrown it away, but if you get a new pack, there will be one on top. With experience and time, you'll sort of know where to punch it. So if you can punch it, put the clamp in and give it to the dentist. The dentist will just be able to put it right over the tooth. Happy days, nice and quick and easy. Assist the dentist by hooking your side of the frame. And let's watch this video. Let's see if it plays perfect. Okay, so I'll go over clamp sizes in a minute. Okay, so here they're selecting which hole they're going to use. So they're going to use the big hole. So this person's obviously experienced. They know where to sort of punch it. So they're going to punch the hole there. You don't want to punch it too close to the edge because then it makes it hard to stretch the dam over the tooth and over the cheek. Typically for root canal, you only need to punch one hole, depending on what you're doing. If you're going to do a filling on an adjacent tooth, or maybe even that tooth, you may want to punch more holes so that you have good visibility of all the teeth. Okay, so you can see the holes go from big to small. So then now they're going to get their clamp, I believe. Okay. That's the bow. So the different types of clamps is winged and wingless. This is a wingless, so you can go from underneath. Okay. Okay, and see these little holes? That's where those little pegs go into the clamp. Forceps. These are forceps, clamp forceps. Goes over the tooth. Okay. And then now the dam is stretched over the teeth. So we poke them through those little holes. Okay, so the dentist will poke them through the holes. And then once we're done, we put the rubber frame on. Okay, so you can help out here by doing your side of the frame. So you just literally stretch it over, put it over those sharp pegs or pins, and it will hold due to the elasticity of the dam. Some dentists like to put the frame on first and then continue to poke the teeth through the holes. Because it stretches out the dam, it makes it easier to line up the holes. Okay, so they're doing pretty well here. And then they might use a wedget. Okay, so they're using the floss now to put the to put the dam down to the base of the tooth or to the gum. Because if it's too high up, it can just fling off the teeth. Okay. Okay, and that's a widget. So they stretched it, cut off a decent size. Don't cut it off too long, otherwise you keep getting it stuck in the rubber dam, in the suction. You can also have scissors on standby just in case, so you can dentist can snip the widget if it's too long. And I believe here they're just removing the rubber dam. Okay, so anyways, that's how to put a rubber dam together. So rubber dam clamps, okay, as I said, there's wingless or there's ones with wings. Okay, so wings are these guys here. You can see another wing there. This is wingless, there's no wing. It's all nice and smooth. Okay, so it's very good and very important if you can remember which clamp to give to the dentist. I've had it numerous times where the dental assistant will give the dentist the wrong clamp. One, it doesn't make any logical sense. And then it doesn't hold the dam down well, and then you'll need to open up another rubber dam clamp packet. Okay, so the size of the tooth dictates which clamp we're going to pick. Okay, so looking at these clamps, which would go where? Hint, look at the beaks. I should say beaks. So this is the beak. Okay, that's the beak there, and look at its circumference. Okay, so you can see from here to here, that's quite long in distance. Okay, it's almost like you can fit a double tooth or a molar. This is a little shorter, okay, but still nice and round. You can fit sort of a premolar in there. And then this here is very tiny. This would be for like an incisor. Okay. Okay, so molar, wide beaks, premolar, narrower, incisor, narrow. Okay, that's the bow, that's the wings, that's the beaks. And then these holes here are for your rubber dam clamp forceps. Okay. So this can be, setting up the rubber dam can be done quickly. So feed the clamp through the punched hole, tuck the wings into the hole. So you, through the hole, put this in, stretch the dam, and then tuck this wing in. Okay, the dentist will put the dam on, secure it with a wedget, stretch the frame over. We saw that in the other video. And then seal the dam with Orasil. It might be optional depending on the dentist, but I always like to use it just in case. You can't go overkill with isolation, the more the better. Alright, so now we're going to get down to business. Everything's set up. So what is the dentist doing? I've included this part here just so that you know what we're doing, because we are aware that it can be a mundane experience for you to assist for root canals. So I guess this is to open up your eyes as to why sometimes the dentist would be stuck on a certain spot. Okay, so step one is we open the chamber. So the dentist with experience can do this quite quickly. Okay, so what we'll do is we'll drill down to the nerve, and then we'll use our Endo Z, our non-end cutting gold shanked drill bit, just to slide across and open up the roof. So this is the roof of the chamber, these are the walls, and then these here are the canals. So we want to open the tooth so we can access these canals and get rid of any bacteria that might be hiding in there. So the dentist will use a crown burr, or I will use a crown burr to drop down, okay, and then we'll use our Endo Z burr to widen the chamber without damaging the floor, because we only need to get rid of this. And then the dentist is going to irrigate. So remember, 2 syringes of 10 mils for myself. The trick to a good root canal and successful root canal is lots of irrigation, because we're killing that bacteria. So the dentist needs to find the canals. Okay, so the dentist will explore for the canals. Typically, incisors, canines, and premolars have 1 canal. Upper first molars, or sometimes second premolars, will have 2 canals. Lower molars might have 3 to 4. Upper molars might have 3 to 4 as well. So it just varies. The dentist will let you know how many canals, and this is important because note taking, and also so you can set up. And it's also important to find that out so you can do a successful root canal. So these are the steps. So stage 1 that we just sort of missed, or phase 1, is where we just open the canals. And then it says here with a safe end stone, so it doesn't cut the bottom. Yeah, so the dentist drills until they feel a drop, which I think will show pretty quickly. Come on, Mr. Dentist, get in there. All right, almost there, and drop. Okay, so now we're into the chamber. Then we're going to use they're going to just use a probe to make sure. So the roof is all that rough bit, and then now we're going to use our Endo Z burr just to smoothen out the edges. Okay, so we're smoothing it out. This is what it looks like inside a tooth. This is an upper molar. Okay, so there's a disto buccal, a palatal, and then sometimes the mesial buccal's got 2. Okay, so we're looking for these little tiny holes. Some cases, younger patients, these may be very easy to spot. Some cases, older patients, these may be very difficult to spot. Okay, so step 1 is we go into the tooth. We find the canals. Step 2 is we find the canals and we go down them all the way. So we put fine files down to measure how long the canals are. So this is where we use our 10 and 15 file. And we also use our ruler to measure. Okay, so that's about 20 and a half mil. They're not really holding the rubber stopper to the edge. But anyways, as we discussed earlier, molars have narrow canals, so we might need a 6 or an 8 file. Have them ready. These are thin and they bend easy, so just have a fair few of them out. Obviously, don't open the packet, just make sure they're on standby. Okay, measurements and reference points need to be recorded. This is because when we come to do stage 2 of the root canal, we know exactly how long it is, or stage 3, we know where to cut off our rubber points. As I said here, other teeth probably just need a 10 and 15. Never say never, but never say always. So just be prepared. Okay, so entering the canal measurements. I myself have a fast notes for root canal. So click on the item number for today's appointment, scroll down to my set of root canal notes, delete the irrelevant teeth, and then enter the measurements and the reference points. Okay, so these are 2 things you have to write down. if you're doing root canal properly. If your dentist doesn't record measurements and reference points, they're probably not doing root canal very well. And then save the notes in Dental for Windows. Okay, so measurements are crucial as they tell us how far the dentist needs to go into the tooth to ensure a clean tooth. Reference points are needed because we're measuring something. We need 2 points. So if you draw a point here and a point here, you need that to measure. Okay, if I just give you a point here, okay, how long is that? From where? You need to know from where. Okay. So example here, Kmart from our Pacific Smiles is 50 meters away from the clinic. However, Kmart is 55 meters from Best and Less. So you need a reference point. Okay, so Best and Less is the shop next door. Okay. Next. Okay, step 3 is to clean the canals. So once a 15 file can be used to the apex, rotary files can then be used. Dentists need what we call a glide path. So we need to make sure when we're going to use these rotary files that it just glides in. Okay, so we use a very fine tool first, a 15, to make sure we can get good access all the way there. And then these just glide in there. Okay, so this is what rotary looks like. Rotary files are used sequentially, which means in order. Okay, not typically, always from smallest to biggest. You never go biggest to smallest. It doesn't make sense. Okay, again, familiarize yourself with your system. Make sure you give the dentist F1, then F2, then F3, then FX, FXL if they're using ProTape or Ultimate. Obviously, it varies. Okay. The reason why we do this is because we want the canal to eventually be widened and shaped to fit the final GP points. Okay. Okay, and then the next logical step is to obturate or to fill the canals. Okay, so prior to this, I've only used hypochlorite or hypo. This stage, I will use EDTA to get rid of any final debris. Okay, and then we have to dry the paper points. Dry the canal with paper points to make sure we get rid of moisture. Okay. So in terms of paper points, if the final file that I used was an F3, give me an F3 paper point. This ensures a snug fit so that all the canal is touching the paper point and it dries efficiently. This also means that less paper points are used, and if it's too thin, it can actually poke through the apex of the tooth and cause irritation and cause it to bleed. Okay, so if you see the dentist pulling out the paper point, a bit of blood, they've gone a little bit too far, or there's still some pulp tissue there. The GP points are then bent to the correct length and tried in to the canals to check for blockages and a snug fit. Okay, then you use your sealer, Tubiseal or Endosequence BC that I use, and then you need to burn off the excess GP. So you need your Bunsen, you need your burn tools, and have your high speed ready when the burn tool is red hot, because if you put the ball burnisher or the burn tool on the GP, it's going to make lots of smoke. It's going to smell like a burning tire. Patients don't like that, so make sure you're ready with a high speed suction so the patient doesn't smell the smoke. Okay, quick video. So this is a decayed tooth, so the dentist is going to go in, clear the decay, clear the nerve. Okay, it's not that quick in real life, so be patient with us. The K files go in with scrub. Obviously there's lots of irrigation and paper points prior to this, and you can see they put the rubber cones in and then they heated it off, and then you put your final filling. Okay, no root canal takes 30 seconds. And then I think they're going to crown prep it. Next, skip. Okay, and then the final step is the final filling. Okay, so bond, flowable. So I like to, once I've sealed off my canals and I've burnt off all the extra rubber points, I rinse it, clean it, and then I put bond and flowable just to seal off the area. Okay, I don't etch because I don't want to put etch and then rinse it, because then water might sort of seep in. a little bit, so I try not to use as much water as possible. Once I've sealed off the rubber points, then I can use my etch quite comfortably because I've put a protection layer, and then I'll etch, bond, and then I'll composite. I like to use a fiber filled composite for this as well, just so the core or the inside of the tooth is a bit stronger. But again, every dentist is different. Cool. And then the final x-ray, as we said, we need to make sure our rubber fillings look good. So the final size 2 PA, I like to use the red holder for posterior teeth. Every clinic's different. Make sure you're aware of what PA holder you use for posteriors. And if it's an anterior tooth, I use a size 1 film on the green holder, or the one that's designed for anterior teeth. Okay, so we've gone through all the steps, okay? But realistically, we can't do every step in the same appointment. We need to temporize the tooth, okay? Again, never say never, never say always. There are some cases where you can do all those steps that I just went through in the one appointment. An example is if a kid or anybody breaks their front tooth and the nerve's exposed, then we're going to clean out the nerve, rinse it, and because we know it's pretty clean on the inside, we can put our rubber plug in quite comfortably and then build up their tooth for them. Okay, but be patient. Good things take time. Okay, so we need to temporize or put a temporary filling at the end of every appointment, apart from the final appointment, obviously. Okay. One thing I didn't cover is additional appointments required for irrigation. So sometimes you might have finished step 2. And you thought to yourself that you've cleaned it properly and everything's fine. The patient may call up and say, I'm still in pain. So the dentist will bring that patient back in, open up the tooth again. So pretty much drill through the temporary filling that I'm about to show you. Give it a good rinse and a good dry, and hopefully that removes enough bacteria for the body to fight off any remaining bacteria. So why do we temporize the tooth? Because we want to seal it off so no bacteria can enter the tooth again. Okay, it's like saving your progress in a game. Okay, so we want to seal the tooth in a way that we can easily access the canals again. So we want to be able to go down those canals quickly. We want to seal it off from bacteria. And we want something that's cheap. We don't want to waste composite on something like this. So it's all in the layers. So I like to use endo sponge. Okay, some dentists will like to use cotton, rolled up cotton. I don't use that because sometimes the cotton, the little sort of stray sort of fibers might stick out, and I'll just draw on it. So if you put a big lump of cotton there, sometimes little fibers might stick out because you haven't gotten it perfectly into a ball. And then if you try to seal it off with your filling, like that, okay, bacteria can go in there just like lighting a fuse, make its way down in there, and then straight down into the chamber again, and then you've lost all your progress. Okay, so I like to get a sponge. So there's little endo sponges that you put your K files in there. So I cut off a little bit. I like these because there's no fray edges. It's all nice and smooth, and it compacts quite nicely. And it's black, so once you get down in there, you can see straight away. And then I just hook my probe in there and flick that out quite quick, quite easy. Okay. And then we use Cavit or Tempet or Quartzol, different brands, but you just need your temporary material. This seals off the area, okay, so you pack it in there, and it's soft, okay, and it does set a little bit when you come to your next appointment. But the reason why we want something soft is because when I drill through this Fuji layer or this composite layer, depending on the tooth, and we'll talk about composite in a sec, I want to be able to drill hard, and then plop, it goes into the softer material, and then I know I'm very close to the sponge. And then what I normally do is I don't drill the cavity all the way. I use my ultrasonic handpiece, and then I use that to sort of just encourage the cavity away from the walls, and then it mixes with the water, makes it easy to suction out, give it a good rinse. And then I'll take out my sponge plug to make sure no debris gets down. Debris goes into those canals. So to recap, sponge, cavit, and then some sort of temporary material. Normally Fuji. Fuji is quite cheap. Typically dentists like to use Fuji 7 pink because the color of the Fuji is quite different to tooth, so we can very nicely go in there without removing more tooth structure and get rid of all that temporary. If it's a front tooth, I like to use Fuji 2 LC because this is more tooth colored, so patients are happier. I don't think your patient will be happy with an orange front tooth. So make sure, use an appropriate material, and again, the dentist will let you know what material to use, but if you are familiar with the dentist, you will know that Fuji pink for back teeth, Fuji 2 for front teeth. In a high aesthetic case, so if I know it's going to be very visible where I enter the tooth for the root canal, I'll probably use composite, and I'll make sure I've got the right shade of composite so that the tooth looks presentable for the patient. And that's it. That is root canals. Okay, so a lot of people are sort of worried about doing root canals, assisting for root canals. They think it's a bit daunting, but I think, and I strongly believe, and I hope you believe as well, that once you know what you're doing, things will be pretty easy. Okay, you'll know what you're getting out and why you're getting it out. Okay, and hopefully I've broken it down nicely for you. Okay, so you know to get the essentials every time, and then set up the extra specific stuff for that appointment. Okay, and anticipating the next step will make sure that you're a very efficient assistant during this process. Okay, and be on the ball. I've done many root canals, and I've seen many dental assistants just zone out and think about what they're about to do on the weekend. And if they were watching, they'll know I was up to the stage where now I need the paper points to tidy up the tooth. So be on the ball, be quick. The quicker you give things to the dentist, the quicker the dentist can do the procedure. The earlier you get to your lunch break, the earlier you get to your coffees. I hope you found that interesting, informative, and all the best with root canals. Have fun.